How to Control High Blood Pressure Instantly, 3D Medical Guide Part 2. Watch Part 1 on our partner channel. Don't forget to subscribe, like, and leave a comment. We'd love to hear your thoughts. Stress reduction for immediate pressure control. How to control your high blood pressure requires addressing the stress component that often triggers acute hypertension episodes. Progressive muscle relaxation. Tense and release muscle groups starting with toes. Hold tension for 5 seconds, release for 10 seconds. Progress systematically through entire body. Complete sequence takes 10 to 15 minutes with immediate benefits. Visualization technique. Close eyes and imagine peaceful, calming scene. Focus on sensory details, sounds, smells, textures. Breathe deeply while maintaining mental imagery. Activates the parasympathetic nervous system within 5 to 10 minutes. Temperature therapy for blood pressure control. How to control your high blood pressure immediately includes strategic temperature applications that trigger immediate vascular responses. Cold water face immersion. Fill a large bowl with cold water, 50 to 60 degrees Fahrenheit. Immerse face for 15 to 30 seconds. Activates the diving reflex, immediately slowing heart rate. Repeat 2 to 3 times with 1-minute intervals. Warm foot soak. Soak feet in warm water, 100 to 105 degrees Fahrenheit, for 15 to 20 minutes. Promotes peripheral vasodilation and blood redistribution. Reduces central blood pressure through improved circulation. Add Epsom salts for enhanced magnesium absorption. Understanding hypertension treatment options. Hypertension treatment varies based on severity, underlying causes, and individual patient factors. Our 3D animation demonstrates how different high blood pressure treatment approaches work at the cellular level. Natural supplements for immediate support. Magnesium glycinate, 200 to 400 milligrams for vascular relaxation. Coenzyme Q10, 100 to 200 milligrams for cellular energy and heart health. Hawthorn extract, 300 to 600 milligrams for immediate cardiovascular support. Always consult healthcare providers before combining with medications. Monitoring and tracking progress. How to lower blood pressure effectively requires consistent monitoring to understand which interventions provide the most significant immediate and sustained benefits for your individual physiology. Proper measurement technique. Rest quietly for 5 minutes before measurement. Use properly sized cuff on bare upper arm. Take 2 to 3 readings 1 minute apart. Record time, activities, and interventions used. Long-term strategies for sustained control. How to lower blood pressure naturally extends beyond emergency interventions to sustainable lifestyle modifications that prevent future hypertension crises. Dietary approaches. DASH diet principles emphasizing fruits, vegetables, and whole grains. Sodium reduction to less than 2,300 milligrams daily, ideally 1,500 milligrams. Increase potassium intake through natural food sources. Lower blood pressure naturally through consistent nutritional choices. Exercise protocols. Regular moderate aerobic activity 150 minutes weekly. Resistance training 2 to 3 times per week. Flexibility and stress reduction activities daily. Wellness approach integrating movement with heart health. Creating your personal emergency action plan. Control high blood pressure immediately requires having a personalized protocol ready before emergencies occur. Your emergency toolkit. 1. Blood pressure monitor for accurate readings. 2. Emergency contact numbers, including healthcare providers. 3. List of current medications and dosages. 4. Written emergency protocol with step-by-step instructions. 5. Natural remedies and supplies readily available. Step-by-step emergency protocol. 1. Check blood pressure and record reading. 2. Begin controlled breathing exercises immediately. 3. Assume optimal positioning with elevated legs. 4. Apply acupressure techniques while breathing. 5. Hydrate appropriately based on assessment. 6. Recheck pressure after 15 to 20 minutes. 7. Seek medical attention if readings remain dangerously elevated. When to seek immediate medical attention. Hypertension symptoms requiring emergency medical intervention include readings above 180/120 millimeters of mercury, accompanied by organ damage symptoms. Critical warning signs. Blood pressure readings above 180/120 millimeters mercury with symptoms. Severe chest pain or pressure, shortness of breath, or difficulty breathing. Severe headache with visual disturbances. Weakness or numbness in face, arms, or legs. Confusion, difficulty speaking, or altered consciousness. Severe nausea or vomiting. Prevention and maintenance. How to reduce high blood pressure instantly becomes less necessary when you implement consistent prevention strategies that maintain optimal cardiovascular wellness. Daily maintenance protocol. Morning blood pressure check before activities. Consistent sleep schedule, 7 to 9 hours nightly. Regular meal timing with balanced nutrition. Stress management techniques practiced daily. Moderate physical activity incorporated throughout the day. Weekly monitoring. Track blood pressure trends and patterns. Identify triggers that cause pressure spikes. Adjust natural interventions based on effectiveness. Review and update emergency action plan as needed. Conclusion and action steps. Understanding how to control high blood pressure instantly empowers you with life-saving knowledge for emergency situations. These evidence-based techniques provide immediate relief while supporting long-term cardiovascular heart health. Your immediate action plan. 1. Practice breathing techniques daily to master them before emergencies. 2. Prepare your emergency toolkit with all necessary supplies. 3. Learn proper blood pressure monitoring techniques. 4. Identify which natural methods work best for your physiology. 5. Establish relationships with healthcare providers for ongoing support. Remember, while these natural methods provide immediate relief for hypertension, they complement but never replace professional medical care for serious high blood pressure conditions. Lower blood pressure goals require comprehensive approaches combining emergency techniques with sustainable lifestyle modifications. What brings down high blood pressure most effectively is the combination of immediate interventions demonstrated today with consistent long-term wellness practices. Your cardiovascular system responds best to gentle, consistent care rather than dramatic interventions. The treatment of high blood pressure continues evolving as medical science advances, but these fundamental natural approaches remain cornerstone strategies for immediate pressure reduction and long-term heart health maintenance.